tell me how you deal with death or dying? Communicate to the interviewer that you know that dealing with death is something that many nurses will experience while on the job. A nurse must not only provide support to patients, but also to family members. Emphasize the empathy, compassion, and overall support that you provided or would provide to family members in a patient death situation. In your response, communicate that it's very important for nurses to take care of themselves outside of the workplace in order to deal with the stress that this aspect of nursing can place on nurses. Some guidelines for you to consider following are: provide a specific example of how you have dealt with this aspect of nursing in the workplace, or how you would deal with it, even if you haven't yet experienced it. Describe the action steps you would take to help the situation and/or the family members, while also emphasizing your compassion and empathy in your response. Remember, this is just an example of the way you could respond to this question. Each person will have their own unique response. Can you tell me how you deal with death or dying?
I think that this is a very important part of being a nurse and a very serious part of our job to not only care for the patient but also their family who's affected by it. I recall dealing with one situation. My first pediatric patient ever was diagnosed with retinal hemorrhages and a subdural hematoma. I had evaluated the family situation and thought that this was completely appropriate. The parents were interactive in a very positive way for the patient's care. And my clinical instructor informed me that those two symptoms were diagnostic for shaken baby syndrome. At that time, I really learned that my evaluation may not have always been accurate, and it was a very eye-opening experience to think that the parents had possibly inflicted harm on their baby. I remember it being a difficult time, and dealing with that patient's death was especially hard for me after being my first patient to pass away. As a nurse, I think it's important to be there for the family members and as a real resource and someone who can answer questions. But personally, it's important to take care of myself as a nurse outside of work, so that these situations really I can be at peace with them and continue with my career in a positive way to be there for my future patients.